Hello, I'm Lisa Vorderbriggen, political editor and columnist for the Contra Costa Times. Welcome to a forum of candidates running for the 7th Congressional District in the general election on November 2nd. District 7 includes Clayton, Hercules, Martinez, Pinole, Pittsburgh, Richmond, San Pablo, Bay Point, Clyde, Crockett, East Richmond, El Sobrante, Mountain View, Pacheco, Port Costa, Rodeo, Rollingwood, Tara Hills, Vine Hill, portions of Concord, Benicia, Vacaville, Vallejo, Green Valley, and portions of unincorporated Solano County. Today's forum is sponsored by the League of Women Voters of Diablo Valley, the Contra Costa Times, Contra Costa Council, Contra Costa TV, Contra Costa Elections Department, and Scholar Ollie at Cal State East Bay, with significant funding from the Lesher Foundation of Walnut Creek. In addition, the cities of Walnut Creek, Richmond, and Concord have generously provided crew for this production. And now, our candidates are Mr. Rick Tubbs, Republican, and Mr. George Miller, incumbent Democrat. We drew lots before the show to determine our speaking order, so we're going to direct our first question to you, Mr. Tubbs. And I think we're going to start with the recently passed House state aid bill, which Mr. Miller was a joint author of, $26 billion to states and school districts to prevent large-scale layoffs. Now, critics say that, why bail out states that are bungling their finances? And proponents are saying, look, the states simply can't be left in this crisis to lay off teachers and firefighters. What's your position on that state aid package? Do you think that's something that the federal government should have done, and would you have supported it if you were in Congress?
I like that question, Lisa, to start out with, because it is the most recent event that has happened. And fiscal responsibility is something that is lacking at all levels of government right now, whether it's state or federal. And this bill simply put off the hard decisions for the states to make to get their budgets balanced so they can afford the jobs that we're trying to save with this bill. Another thing that concerned me about the $26 billion package is that it cut food stamps. Lisa, I grew up on welfare. The way we ate was through food stamps. And to think that children in District 7 are not going to get as much food that because of the cuts in food stamps concerns me. I don't think we should be cutting this critical community service for this other service that we're providing. I didn't like the way the bill was paid for. And then lastly, we're closing loopholes for businesses sending jobs overseas, which I support. I think that was a good thing. But we did nothing on the other side to help businesses grow those jobs here in America. So on 3 levels, I don't like the bill the way it played out. I do think teachers are important, absolutely important. The way I got out of welfare and lived the American dream was through education. It's very important.
Okay. Well, let's let Mr. Miller, who is a co-author of this bill, answer some of those questions specifically about the food stamps issue and why in particular you felt so strongly about supporting and writing this bill.
Well, I think it was very important because certainly school districts and cities and counties have made very tough decisions already. It's not like they're not laying anybody off until the federal government can come help pay for them. The fact is they had drastic layoffs last year, continued of those layoffs this year. I think in our district about 600 teachers were given layoff notices. This bill will allow about 200, 250 to come in. But schools have already cut librarians, they've cut resource people, they've cut health officers, they've cut counselors. Those decisions have been made. And at some point, if you're going to emerge from this economic downturn, you cannot have the children in our schools losing a year because of that economic downturn. Economists have warned us, both liberal and conservative, over the past year that what's happening at state and local governments could drag this economy back into a second leg of a downturn. And of course, now what you see is the economy slowing. People are continue to be fearful of losing their jobs, and they're not going out and purchasing and participating in the economy. And this was a crucial way to get that to vital services. The teachers, the health professionals, the firemen, the policemen, those are the services that hold our communities together. And they're very important services. And again, the cities that I represent, the school districts that I represent, are making very tough decisions about their budgets. But we still need these services, and I think it was absolutely critical. It was paid for 2 ways. We cut some of the cost of future food stamp costs. I hope that we'll be able to replace those. That was done in the Senate. That's not how we paid for it in the House. And we also ended this outrageous tax incentive for companies to send jobs overseas. And in terms of tax cuts for businesses, we've had multiple tax cuts to small businesses for hiring people, for expensing their equipment instead of depreciating it, and allowing them tax incentives to be able to borrow, to keep their businesses going, and to encourage banks to go. And it's very interesting. You're starting to see in the press in the district that I represent of small businesses that are doing exactly that. They're taking advantage of the SBA loans. They're taking advantage of the expensing, buying new equipment, and each of those businesses have said that they're hiring new employees because of the help they got. That's what the federal government has to do, is to help generate this. We know the banks basically have refused to lend to small businesses, and that's starting to come back.
Yeah, we'll get to a specific jobs question clearly. Now, let's do a shift to health care, and I know that's one of the big issues on the minds of voters across America, and you, of course, are a huge proponent of President Obama's health care reform legislation, helped write that legislation. Give us just a short summary of why you felt that was so significant and why you supported it, and we'll give Mr. Tubbs an opportunity to give his view.
Because it's very clear, if you speak to big businesses, if you speak to international businesses, small businesses, and families, the cost of health care is crushing them prior to the passage of this bill. Large companies were shedding health insurance. They were passing off more and more to their employees as they were getting rid of the cost. Small businesses that wanted to offer it couldn't afford to do that, and families couldn't afford to pay the premiums. Nobody believed that this was a sustainable system, and most people believed that it was a drag on the economy. What we did is provide for insurance reforms, to provide tax credits to small businesses, to help them offer insurance to large employers. People can stay on their plans, but we also did the insurance reforms of no pre-existing conditions. You couldn't lose your insurance. Your kids could stay on until they're 26, so they couldn't arbitrarily be kicked off. People who couldn't find insurance are now able today to go to state pools and find affordable insurance because of their health conditions. And we lowered the cost of prescription drugs to senior citizens. But all of that had to be done in a unified bill. I know the Republicans say, well, they just want to cherry pick various pieces of that. The fact of the matter is, you cannot do this kind of reform unless everybody's in the system. You shouldn't have free riders, people who just decide they won't buy insurance, but they'll show up at the county hospital or the emergency room at John Muir when they get into trouble, and the rest of us will pay the bill. In California, let me just say this, about 15% of your premium was going to people who did not have insurance in this state, and that was just unaffordable for businesses and for families.
Okay. Now, many of the Republican candidates have said if they got to Congress, they will work to repeal or not fund, not implement many portions of this bill. What is your position on this health care legislation? What would you do if you went to Congress?
Sure. And I've heard that repeal statement out there, and I don't think repealing health care reform is the right way to go, but I do say we need to replace the bill that is in place. George and I have similar goals, and I certainly do think there was reforms that needed to happen in the healthcare industry. But the first two things I would have went after is making healthcare cheaper by going after the $100 billion of Medicare fraud in the system, almost a quarter of the budget, and then going after tort reform. I talk to doctors, I sit down with them, I have lunch with them, and I ask them what would help. And they say half of the procedures they perform on patients is to satisfy malpractice lawsuits and lawyers instead of taking care of the patient's problems. This is where I would have addressed the first things I would have gone after in the healthcare is to make it cheaper in the inefficiency and waste that's there. And then we can look at covering everybody in the system. Certainly, coverage for everybody is a priority, and I think it's good. But let's make it cheaper so we can afford it. You see healthcare insurance premiums already going up for January of 2011. This is the reaction to the health care bill that was passed.
All right, let's talk about.
But let me just say that's not sustainable. The fact is, in California, you've had tort reform now for over almost 20 years, and the number of procedures doctors use hasn't changed. In Texas, you've had tort reform. The number of procedures doctors use haven't. That's wonderful for insurance companies. It's just not very good for the doctors, or it's not very good for the patients. The fact is, in the first year, this bill, the first 10 years, this bill will save over $100 billion because we now start to reimburse people for the effectiveness of the treatment they're giving, rather than just running people through procedures. Over the next 10 years, according to the Congressional Budget Office, nonpartisan office, it'll save over $1 trillion because of the efficiencies and having everybody in the system. So costs will be driven down for small businesses because of tax cuts, and costs will be driven down for families because they'll be in a larger pool. And that's how insurance works. And that's what's going to happen with this legislation.
At least if I could address that.
Very quickly, and then we'll move
Sure.
on to Wall Street reform.
We heard the same thing when Medicare was passed, and you weren't in Congress back then, but if you think the inefficiency of the federal government is going to drive down the cost of health care, it's disregarding what has happened for the federal government programs that have been through the past. This will not save us money.
But Rick,
It'll
you
be
know
more
that Medicare
expensive.
is the most efficient purchaser of health care in the country. They're for about 2%. Private sector, 25 to 35% overhead. You get that out of the system and you can lower people's premiums. So you want to take the most efficient system and throw it out. The reason Medicare has gone up because we have more people on Medicare and we've added benefits like prescription drugs and preventative services to that to improve the health care for senior citizens, and that will continue.
Sure, but I think the promise of government making things cheaper and more efficient
We
is
just
an
did with
empty
Medicare.
promise.
We just did with Medicare.
Well,
The fact is, millions of seniors had no access to health insurance. Millions of early retirees had no access to health insurance, and they've done that. You want to repeal Medicare? That's fine, but
I didn't say that.
I'm not going to support that.
I didn't say repeal Medicare.
Well, but you use that as an example. Somehow it's out of control. The fact of the matter is, it's because we've improved the benefits, and this bill is going to be the same way. It's going to draw down. It's going to draw down the cost from waste, fraud, and abuse. My amendment was accepted, which now is being given credit by 60 Minutes, by the Attorney General's office, of being able to capture tens of millions of dollars in waste and fraud of people who sell phony appliances to people who aren't even on Medicare, or in many instances don't need that work.
Okay, I think we're clear on both of your positions on that. So let's. I know that
We could spend the
I know
entire
that
24
we could
minutes.
spend the entire time talking about healthcare. I know it's a very complex issue.